Hello everyone. Today we will discuss two reflexes that appear and disappear almost together. And not to forget, they also serve an almost similar function. Yes, you're right, that's sucking reflex and rooting reflex. Rooting reflex allows a child to locate their food source, and once a child finds its food source, locates it, the sucking reflex comes into action and allows the child to suck and swallow the milk. Both of these reflexes ensures successful breastfeeding. Yes, they are the survival reflexes. Now, how to test these reflexes? It's very simple. If you gently stroke any side of newborn cheeks, then they will turn their head to the side on which we have applied stroking. It is just as simple as stroking with your fingers. Now, once they rotate their head on that particular side, you will have to apply a very gentle stroke on mouth or lip area of the child. Immediately the child will start doing sucking motions with their lip and mouth area. So both of these reflexes allows a child to have a successful feeding. Now, if these reflexes are not well developed, then child will find difficulty in having proper feeding and it will hamper the growth and development. Now, these reflexes are present since gestation. When a baby is inside mother's womb, these reflexes are already developing and are present up till 4 months of age after the birth. Now, when you see an ultrasonography of a pregnant lady, then you will notice that a baby is sucking their thumb or fingers, and it's so fascinating. And this is an evidence that the reflex is present during pregnancy. And after pregnancy, up to 4 months of age, it is ensuring normal growth and development of the child. Now, if a baby is born prematurely, then of course these reflexes are not well developed, and because of which they will need tube feeding as an assistance for ensuring optimum feeding. And even if these reflexes are not well developed, then again a child will find difficulty in establishing coordination between sucking, swallowing and breathing. Again, it will hamper child's normal development. Now, we will see what are the issues occurring if these reflexes are retained beyond 4 months of age. If these reflexes are not integrated properly, then it can contribute to problems related to eating disorders, speech, writing and thyroid problems. Such kids will have a constant urge to have something in their mouth, yet are often sensitive to textures. They have hypersensitivity around their mouth. However, they find difficulty with textures and solid foods, which makes them picky eaters. You will find them always chewing on something such as plastic or rubber toys. Drooling and dribbling of saliva is also noticed. They also have difficulty in articulation of speech because of dental problems. They will have persistent thumb sucking, which ultimately creates dental problems commonly known as buck teeth or open bite in kids. Yes, because of this, they struggle to form words and have articulation issues. They also seem to have hormone imbalance and autoimmune tendency. They will also find difficulty to read and write together because of dexterity problems when talking. So if any of these signs are present in your child, then it indicates persistence of sucking or rooting reflex. So let us see how we can help in integration of these reflexes with Reflex Integration Exercises and Oral Praxis. Let's begin. For these exercises, make the child sit in front of you with his mouth slightly open. Apply 3 consecutive strokes from right ear to right corner of mouth and then repeat on opposite side. Next, apply 3 consecutive strokes from right corner of nose to right corner of mouth and repeat same on the opposite side. While applying strokes, child needs to keep his lips and mouth static, means no movement or twitching should occur. Now, a child with retained rooting reflex will have twitching when strokes are applied. But if this technique is practiced regularly for 4 to 6 weeks, then the desired learned behavior will replace the reflex twitching movement. Now we will see oral praxis exercises.